First of all, I would like to thank Dr. Skantesh for giving me an opportunity to share a few of the examples which I have treated. The purpose of this meet is not only to share the case experiences and what is the impact after sharing the experiences, and how did my friends in the field of modern medicine, how they have opened up to modern medicine, also is a significant step towards implementing Ayurveda in emergency care settings. So as we know, without delaying, I would like to take just 10 minutes and I would like to cover 3 important cases, which I have previously shared in other webinars also, but the impact of it and how it is helping us to treat other cases. For example, as we know, once a person develops pulmonary hypertension, either due to COPD or many of the obstructive sleep apnea patients are put upon BiPAP devices, which they have to wear for the rest of their life or night for 12 hours, etc. And these were the conditions which previously I was not treating. But after some of the cases, especially after COVID, this one case I would like to share the screen and post a video. Is the screen share visible? Hello, is the screen share visible?
Yes, it's visible.
Boss.
Yeah, it's visible.
Yeah. This is one of the case. Actually, she was kept in a special ward in a corporate hospital in Bangalore, and she was on. If you see, this is a high flow nasal oxygen, which actually cannula, which delivers oxygen of around 40 to 50 liters per minute. It was like a mini ICU setup. She was kept in this ward just to make her wait for lung transplantation. And she was a 60-year-old female with no comorbidities. And once she was diagnosed with COVID, she was admitted in the same hospital and discharged. And she once again got readmitted to the same hospital in view of breathlessness. And once she was admitted to the hospital, she was diagnosed with post-COVID fibrosis, which was of severe in nature and requiring lung transplantation. And they had gone to Apollo Chennai and made an advance payment for lung transplantation also. And because of some influence, they were able to reduce the waiting period to just 2 months. And the plan was to keep her in the hospital for 2 months in this condition till the suitable lung donor was available. And this was her condition. And as we see in the video, also in the X-ray, which shows the complete whiteout of the lung. That is, even her lung volume was almost reduced to the minimum possible extent. And she was not even able to speak because of the loss of lung volume. Her vocal cords were not supported with enough volume so that she could speak. And this was a condition where she had a recurrent respiratory tract infection. And she was in a very difficult position because even she had to remove it for a few seconds to have her food or she was not able to go to a washroom. Saturation is to drop to 40 even without oxygen for 20 seconds. This was the severity of lung fibrosis. And this is the pulmonary hypertension, which shows severe pulmonary artery hypertension, which shows the pulmonary artery pressure of 75. And according to modern medicine, as I have discussed with many of my seniors, cardiologists and pulmonologists, according to them, pulmonary hypertension can never be reversed. And even in case of reversal, a person has to be kept on for oxygen supplementation for a year or so. In such conditions, severe pulmonary hypertension might become moderate. And this is, and after starting treatment, after 5 days, repeat echo was done, which showed mild pulmonary artery hypertension, and the pulmonary pressure, which was 75, had become 40. So, which shows a quick reversal of the need for lung transplantation. And this is actually almost a year back. And after 1 year, now, according to the expectation, if this is a lung picture, even after the patient gets discharged, she has to be on continuous oxygen support. And she completely regained her voice and she is able to go for a walk without any need for oxygen. This is, I think, we have. She is not ready to come back for a follow-up. I'm interested to get a follow-up X-ray also, for which the patient party is not willing. And she is, but her present situation is she is normal. She is not requiring any oxygen even for a brisk walk also. And the importance of this is, after this, I started getting many obstructive sleep apnea patients. They are actually either obese patients, and most of them, at least 20 to 30% of the obstructive sleep apnea patients are associated with the COPD, and they require almost sometimes 18 to 20 hours of BiPAP if the condition is severe, or at least 12 hours of BiPAP. So once we got to know that Ayurveda medicines have the capacity to quickly reverse the pulmonary hypertension, which is actually the key pathology which we are not able to reverse in modern medicine. It gave me the courage to treat many such patients who come with pulmonary hypertension. And many of the obstructive sleep apnea patients, obese patients, who were requiring BiPAP, use of BiPAP during night time, are completely weaned off. Now they are able to sleep comfortably without BiPAP, and even it has given relief to many of the other post-COVID fibrosis, mild and moderate cases also, who were oxygen dependent since a year, are completely weaned off from oxygen. And I think we can tap in such areas where modern medicine has almost zero intervention. Even we prescribe nintedanib, antifibrotic agents, etc. And we are all aware that it is of no use. Even I have seen patients that take these medicines for 6 months or 1 year, but it has not helped to reverse fibrosis. On the other hand, the very strength of Ayurveda medicine is to reverse the fibrosis, which will actually reverse the pulmonary hypertension. So, and second case is regarding one of the which initially I had shared in webinars about a COVID patient almost 1.5 years back, where her saturation was 42, and she was getting ready for discharge, and because of cytokine storm, her condition once again deteriorated, and this was her condition with saturation of 42, and she was gasping, and they were planning to intubate her. She was on non-invasive ventilation. And during the second wave of COVID in our hospital, once a person was intubated, the chance of survival was very less. So, and this is after 2 hours of Ayurveda treatment, she recovered. And even when we come to the in our hospital, every month we have mortality meeting. People from all the departments, pediatrics, ortho, gynec, surgery, medicine, everyone gather. And the main concern in our hospital at present is the case of antibiotic resistance. Any head injury patient getting admitted to the hospital is dying because of sepsis, septic shock, because of pneumonia. Because when it comes to, as we know, we are running out of antibiotics nowadays. Bacteria are becoming resistant to resistant to antibiotics. And the same case, the ICU patient, actually her counts had reduced from 25,000 to 11,000 without any use of antibiotics, only Ayurveda medicine. Why? The reason of stopping these medicines, antibiotics, were, in spite of all the meropenem or the high-end antibiotics, her counts was 25,000. It was still high. Once we get the picture that she has developed resistance to most of the antibiotics, I usually stop the antibiotics and keep her only on intense Ayurveda treatment to treat sepsis. And this has become very much relevant in the current era. Maybe 5 years down the line, this result of Ayurveda will gain even more scope. The reason being, for example, 10 years down the line, number of patients admitted to hospital dying of septic shock maybe was 10%. In the next 5 years, it can become 50%. So we may have robotic surgeries, hi-fi, wireless technologies, etc. But the patient will be dying of septic shock. This is a reality. And I think Ayurveda is the only medicine which can rescue in such conditions. I think which was working 1,000 years back will work for next 1,000 years also. With that confidence, we can say that when it comes to treating sepsis, septic shock, antibiotic resistance, Ayurveda really has a great upper hand. And another one case recently which I have treated, I am working closely with some of the oncologists. This is how I convince my seniors and my friends. Whenever we start palliative care, especially in case of oncology, that is end of life care. So are we not justified in sending the patient to some other system of care where the patient can get some hope of recovery? So discussing with my seniors, and has definitely resulted in positive outcomes. Now, many of my seniors who are working in corporate hospitals in Bangalore, once the patient develops resistance to most of the antineoplastic agents, they refer the patients to me. Once the patient progresses on first line, second line chemotherapy drugs, or if there is a recurrence after surgery, etc., they're not going to further try any other chemo or radiation, etc., because the general health of the patient is already in the worst possible condition, and hence they're referring the patients to me. This is one condition of the patient with head and neck cancer, to be precise, buccal mucosal C. She was already operated, surgery, chemotherapy, radiation was done, and within 6 months there was a recurrence. And during diagnosis, initially, the size of the tumor was 3 centimeter adjacent to the left mandible. And after 3 months of chemotherapy, 3 centimeter progressed to 5 centimeter, 5 became 8 centimeter, and she had brain mets and multiple cervical lymph nodes. And she had ulceroproliferative growth in the inner aspect of the mouth also, which was actually bleeding on touch, foul smelling, purulent discharge also. And the swelling was stony hard in consistency. And she was prescribed 2 morphine tablets per day. Am I audible, uh, Dr. Skantesh?
Yeah. Please, you are audible.
Yeah. And actually, she was prescribed just 2 morphine tablets per day. And as the patient's son is a medical owner, morphine was easily available for them. And whenever the patient's son used to take note of her pain, he used to immediately give one morphine. And she was taking 6 to 7 morphine per day with 3 diclofenac injections per day. Still, her pain was, she was in extreme pain. She was moaning with pain. And doctors in May had given a time of just 15 days for her. And in this condition, as we know, people come and ask, is there any medicine in Ayurveda which can shrink the tumor? Or when it comes to pain, is there a need to say that I will give Ayurveda medicine for like other condition, but for pain, you have to continue, etc. Patients had many other confusions, and they have come for treatment. I was able to convince that within 15 days or 1 week, there should be some improvement. And this is actually this will actually give a confidence to continue Ayurveda treatment. So I convinced the patient party to start treatment for just for 5 days initially, then another 5 days. So after 15 days of Ayurveda treatment, this is the condition of the patient. So, and as we are able to clearly make out, even the ulceroproliferative lesion had completely sloughed up from the inner aspect of the mouth, and the tumor, the size of the tumor, 8 centimeter, had shrunken in a span of 1 month to just 3 centimeter. I had got a PET scan done also, which I can share the reports, and the cervical lymph nodes had disappeared in a span of 1 month, and the brain mets. The lesion is stable. The perilesion edema, etc., had completely stopped. And for example, even and another important improvement is she's completely off morphine within 15 days of starting Ayurveda treatment. She's completely pain-free without morphine tablets. So this is the, I think, a scope of Ayurveda treatment when it comes to palliative care. At least 50 to 60% of the patients whom we think of palliative care or end-of-life care can be given a significant quality of life, or I think it can be even cured. And considering this result, what I feel is many of the times when it comes to cancer care, most of the time I think it is not correct from our side to continue the medicines what is given there. Many times what happens is we continue the medicine. For example, she was put on anti-epileptic drug because she had a brain mets. There is a risk of developing fits. So I stopped that and started Yogendra Rasam, which is a much better anti-epileptic drug than sodium valproate, etc. She was put upon dexamethasone because most of the time brain met lesion in the brain will have edema over the lesion, so which can cause compressive symptom. But it's not required when we have our diuretics like Punanava, Mandara, Chandraprabhavati, etc. For example, there is no need of giving steroids. So I think the success of Ayurveda treatment even lies in stopping the medicine which is not required from the allopathy side also. And I've seen the difference when people take medicine whatever is given in the modern medicine side and continue Ayurveda treatment, even if the best treatment is given, the benefits of Ayurveda medicine will be nullified by the medicine unnecessary medicine what is being given in the modern medicine side. I think definitely we have a much better native system of medicine. For example, I stop pan and start on Sukshekarasa, etc. We have a definitive medicines which can take care of the same purpose what is being given in modern medicine. when it comes to cancer care, I think there is no need of thinking of Ayurveda medicines to support chemotherapy or support radiation. When it is not at all required, I think Ayurveda medicine can clearly play a major role, not even in primary tumors, but also in palliative care. Thank you.
Thank you, Dr. Ashok. This was an enlightening presentation. So I think
Thank you, Scott.
maybe it is a time for participants if they have any question and if they want to know something more regarding these interventions. We have Dr. Avatar Singh as well. So as part of Integrated Ayurveda Network, he's also one of the scientific chair in Integrated Ayurveda Network. So he can make a comment on presentation of Dr. Avatar. Invite Dr. Avatar. Yeah. Dr. Avatar Singh, you are muted.
Is it okay now?
Yeah,
Hello?
it's okay now.
Oh,
please.
can you
Yeah.
hear me? Thank you very much to invite me. Before me is Doctor, I don't know the name. How can I pronounce? But you've done a very good job, sir. Young man. Really, I really appreciate. So I'm also doing the cancer treatments here from last 10 years. Yeah, I treated nearly patients, which one is hospital say no hope. The same kind of, I believe what you're saying, Ayurveda can do anything. And if the Ayurveda practitioner diagnose properly, we can give them very best result. This one, same my family is also, whole family, grandfather, great-grandfather, we are belong to the Ayurveda family. And I'm doing this on Ayurveda for the last 55 years. And what you said, I designed Ayurveda cancer treatment. After that one, I treated many types of illness, like ADHD, dementia, Alzheimer's, and I designed my own formula, do the custom-made medicine for the cancer patients. In the UK, I treated so many, which one hospital say they can't live anymore more than 2 to 3 weeks. People are still living with the Ayurveda, 100% with the Ayurveda medicine. That time they stopped giving any chemotherapy, any other medicine. They only giving the morphine painkiller to them. And for your knowledge, I designed one painkiller. You no need to give the morphine. That one is, I designed that formula. Dr. Joshi may be listening. If they're listening, he was with me when I giving start. We gave the 3-4 patient, and all 3-4 patient is our Ayurveda formula is benefit. With the morphine, they become constipated, you know. But with the Ayurveda, they not have the constipated patient, and 5 to 6 hours, they can relieve the pain. And this kind of so many patients we done here. After that one, with the Ayurveda, I designed one formula in the 2020 for the COVID. I treated more than 120, 125 patient, COVID positive patient. Within 3 to 4 days, they become negative, and one formula work on every variant. On my website, on my YouTube, and everything, we put it on that one. I challenge all the pharmaceutical company, if my formula is working, Ayurveda is working on that one, why are you giving the injections that one? And all the people there, they know everything. So Ayurveda, if somebody diagnosed properly, I think, in my point of view, if somebody knows what is actually going on in the body, what is the reason, what is the root cause of the problem, Ayurveda can treat any kind of treatment, any kind of illness, and not difficult. We can, even hospitals say there's no hope, we can still give the hope. Okay, if they've gone too far, maybe people can't survive, but 70 to 80%, I have the record. That's the reason I treated in the American hospital. We got all the details. I don't know, we have to give the details here. I have all the hospital reports from the Dubai. The cancer patient, they say the liver should be transplant. They multi-cyst on the liver, they are active. And on the kidney, there are 6 cysts on the active, 2 they removed, and the same kidney within 1 month start flushing 90%. And that liver, that patient is in 2019, if that person is still living, no need to change the liver, no need to change the kidney. And there's colon have the polyps in that one, and he was the diabetic. And then they invite me in the American hospital in the Dubai, and Dr. Keeler, they asked me, what do you do? How you do it? This one, I said, this is the Ayurveda. This kind of so many cases, if we have to, I think, teach the people, educate the people. If they don't delay too much to come to the Ayurveda, and they can get very quickly benefit from any kind of problem. They can save their lives. Problem is, when they do so many chemotherapy, then the body is completely, when people come mostly to us when they are lost, no any hope. This is the big problem, because I think our Ayurveda people, the problem, not so many people openly say, I know so many. This I say, they can't diagnose properly, and they're not making medicine themselves. Most of our Ayurveda practitioners, they rely on the pharmaceutical companies. And like this kind of condition, in my experience, we need to be custom-made medicine like you given to them. And this is the main problem in the Ayurveda. Otherwise, if all the Ayurveda practitioners little bit do the more practice, share with each other how they're doing this one, and start learning from each other, we can, in the world, we can tell the world, we can do many things, which one allopathy is very hard to do it. Allopathy is a great job. They're doing very nicely. They're doing, they're checking their system, their diagnosis system. They're telling which organ is which way, X-rays, chemo, everything. They are very good on that one. Which one we don't have in our Ayurveda system, that kind of things. But only problem we are, I think so, can't tell the people, can't educate the people, don't delay too much. If the 2, 3, 4 chemotherapy, even take it after that one, stop it. I mostly say to my every patient till now, I say, give us first 2 weeks. If within 2 weeks, even a cancer patient, if you can't get any benefit, go to chemotherapy. This is I done, and with me, Dr. Joshi seen nearly 20, 25 patients with me, and all the people, there are few of them, they not survive. Only the reason, because they not follow the diet properly. If we look after them properly, other people are all our cancer patient and other patient, they are surviving. They're doing well. They're living from, my first patient is 10 years ago, he's still living. There's no any cancer after that one. So Ayurveda, we can do so many things. We have to work more. And I think we have to be, Ayurveda practitioners should have to be diagnose system, learn more. And medicine, they should have, give them the custom-made medicine. They should learn that one, what medicine actually they need to the body that time. That is my style to do the treatment. That is, and I have a lot of successful treatments. I done that one. And any question or anything they want to ask, I'm happy to give the answers.
Yeah, thank you, Dr. Avadar, for your important suggestion. So it is important to see some personalization and customization is being made in order to make these interventions more specific and to make the practice-based evidence also more meaningful. So I'm also requesting if any other participants can ask any questions or inquiries still. So we have some more time to go with another speaker. So maybe we can go with any other questions.
Hi, Dr. Deepak. I'm Dr. Bharti. I'm also an allopathy doctor. I'm also linked to Bangalore Medical College. I did my PG and UG from Bangalore Medical College. It's very nice to see that an allopathy doctor is using our traditional techniques of Ayurveda, which is more than a 5,000-year-old. Only lack is we need more of a research, evidence-based practice as an allopathy doctor will do. Of course, everything cannot be done on the same way as an allopathy because it needs to be more of a holistic approach what we use when we use other traditional system of medicine. So I have very few questions with you because when we are talking to people, some people may have some few questions, especially with respect to the evidence-based therapy. My first question: can you make us clear in which stages of cancer where Ayurveda can play a role? Of course, definitely stage 4. Most of us we are aware, and we know from such practices also. As another doctor was also telling, we may try it for a few stages of chemotherapy. If they don't respond, then we can refer them to an allopathy doctor or something like that. So I just want to know in which stages of cancer Ayurveda can be given. That is one. And what about the drug interactions when we are using two different system of medicine? In most of our allopathy, we know the drug content. I'm not aware of much about the Ayurvedic drugs, what is a combination, everything. So from the law point of view, how to balance these, and is there any evidence in that way?
Thanks for attending this program and coming out to guide us and motivate us. Coming to the first question, madam, regarding which stage of cancer patients can be treated. My aim is, and as you know, madam, many of the times, my father is is old student of Bangalore Medical College, and he has an Ayurveda course also, and my mother is Ayurveda physician. So, and why I took up surgery is my mother's guru, Dr. Muralidhar Sharma sir. He is one of the well-known Ayurveda surgeons of South India, and he has follow-up of 35 years patients up to 35 years, for example, of breast cancer patients. And most of the time in the last 20-30 years, people had no insurance. Where I did my MBBS in KMC Manipal after, especially for breast cancer, for example, after modified radical mastectomy was done, the patient was suggested chemo during follow-up. They had no money and they came to us for another treatment. And there are patients, number of patients being followed up from 30 to 35 years. So, and what question started coming to my mind by the time I joined MBBS in 2012 is patients actually are there any medicines in Ayurveda or procedures in Ayurveda which can actually total bypass radiation and chemotherapy? Because in my second year, when I read Robbins' pathology, where they have mentioned an important sentence in 6th chapter of oncology, where they said 40 to 45% of the deaths in cancer patients it's because of side effects of chemo and radiation, and not because of cancer. And this is actually premature death, which the cancer might have caused death maybe after a few years, but side effects of chemo radiation has caused death on a much earlier time. So this made me think that, and many a times when I start taking up Ayurveda, many a times according to the principles of Ayurveda surgery or according to Sushruta Samhita, which is the treatise of Ayurveda surgery, many a times when I spoke with many of the Shalya experts or the Ayurveda surgery experts, they recommended surgery has to be done in many cases. Then Ayurveda treatment has to be given. And when I compare the text, many of the time similar things have been mentioned. For example, the moment tumor debulking is done, it increases the tumor immunity of the body, or number of circulating cancer cells in the body reduces, or the tumor necrosis factor released into the blood reduces. So many of the concepts of modern medicine and Ayurveda are similar. But as we know, madam, in the present scenario, Ayurveda surgeons are not in a position to do such surgeries. So I took up surgery so as to integrate with the oncology and surgery and many of the surgical aspects of Ayurveda and surgical aspects of modern medicine. So, for example, I feel when it comes to stage 1 cancer and breast cancer also, many of the times when the patient goes for PET scan, FNAC, etc., it takes 15-20 days. Initially, the size of the tumor would be 5 centimeter. I start intense Ayurveda treatment and make it 3 centimeter. What we think of a neoadjuvant chemotherapy, same thing I do in neoadjuvant Ayurveda therapy. Axial lymph nodes, the size 1.5 centimeter had to become 0.5 centimeter. So we are effectively downstaging the tumor in a span of just 15 days. So for me as a surgeon, I will get a better clearance. So even the fibrosis around the tissue will be minimized. So my surgery will be easy. And after mastectomy, once again we are continuing Ayurveda treatment. And nowadays, madam, like even what stage many of the people are getting undergoing genetic testing. They are diagnosed with BRCA1 positive, and even their children are getting tested with BRCA1 positive at the age of 18-20 years. In modern medicine, we have to just wait till they complete their family by the age of 28-30. And like in Western countries, we may have to start prophylactic mastectomy and prophylactic oophorectomy. And when I left Manipal, a 60 lakh project was sanctioned, madam, which is a very interesting thing, where they are doing the study on the BRCA1 positive patients who are subjected to intense panchakarma treatment. And after 6 months, the same gene is tested once again, and they're checking for the methylation and demethylation changes just to see whether the gene has been deactivated or not. So I think the scope of Ayurveda treatment can start from planning for neoadjuvant Ayurveda therapy and surgery, and then post-operatively continuing with Ayurveda treatment. And as I discussed, madam, when it comes to palliative care, definitely our Ayurveda treatment has a definite upper hand when it comes to pain management, quality of life, etc. And even post-operatively in our hospital, most of the patients had surgical site infection, seroma formation, etc. But what I realized was patient has already taken antibiotics for 5 days. Instead of prescribing the antibiotic once again for 5 days, I started giving Ayurveda medicines. So, and the incidence of seroma formation post-operatively and incidence of surgical site infection reduced by 90%. So this is the difference what we are getting. We can start from not only the cancer care, even post-operative, the quality of life, or the stricture, urethra stricture, where we have to go for repeated dilatation, etc., can be given a relief in a span of few days. Where on the repeat scopy, when the cystoscopy was done, stricture had completely disappeared after Ayurveda treatment. And when it comes to the drug interaction, most of the time when I start patients on Ayurveda treatment, most of the medicine from modern medicines that I stop usually and keep them on minimum medicine, which can cause actually, for example, antihypertensive medicine or their cardiac medication or thyroid medication, which we are not supposed to stop abruptly, which we are supposed to taper and stop. Other medicines, and the difference between I realized was like when it comes to anti-diabetic medication, there is a risk of hypoglycemia when it comes to our side when we give insulin, etc. When the patient is not taking enough food, etc. But in case of Ayurveda medicine, I haven't seen even a single case of hypoglycemia. So many of the patients, they ask when I start taking even Ayurveda medicine, will it not result in hypoglycemia? And what I have understood is when it comes to hyper and hypothyroidism, the medicine in Ayurveda is same. It usually tries to get in balance the functioning of the gland or any organ. So, and the way the two medicines function, I don't think Ayurveda medicine competes with the same receptor as we do with the modern medicine. So, and even my parents' experience, they are totally like many of the time, the way these two medicines work is a different way. So we need not really bother about the drug interaction or whether the efficacy of Ayurveda medicine or modern medicine will be nullifying each other, etc. Or there will be no over amplification of the action of the medicine for the same purpose also. And when it comes to legal purpose, legal aspect, madam, in Karnataka, there is Karnataka Private Medical Establishment Act. According to that, if Ayurveda medicines are given in allopathy or modern medicine setup, a person can be behind bars. This is the law made. But during my MBBS days, for example, a nephrologist used to come to our class and say that I have seen many patients that Ayurveda medicines are causing liver, kidney damage, etc. And after finishing the class at 9 o'clock, when we had to go to nephro OPD, our postings, and for any raised creatinine patient, he used to prescribe K4 tablet from Zandu, which had copper sulfate. So, and when it comes to infertility treatment, I don't want to name the hospital where I did my undergraduation. There it is making very good name for treatment of infertility. But a person with low sperm count is given Adizova syrup from Charak Pharma. As you know, Madam, clomiphene citrate is not that of great use and not of side effect when it comes to increasing the sperm count in case of male infertility. And if the woman's anti-mullerian hormone is low, the success of IVF is very less. So patient is sent to Panchkarma treatment for to increase the anti-mullerian hormone and then asked to come back for IVF treatment. Or in the postnatal wards, like bee protein powder, postnatal mothers are prescribed Shatavari powders to increase milk production. What I feel is, on one hand, we are talking of legal issue or making a rule that we cannot give Ayurveda medicines in allopathy hospitals. Now in Bangalore, Cloud9 hospitals have started Ayurveda OPD. In Shankara Cancer Hospital in Bangalore, they have started Ayurveda OPD. I think Ayurveda, as you know, is not a system of medicine; it is a way of life. And whatever system of medicine I practice, I think I cannot take the name of law and keep Ayurveda separately. This will definitely in the next few years play a major role. And what I feel is, as a surgeon, I will not replace my practice with Ayurveda. As a surgeon, I will have a lot of limitations, as we discussed about antibiotic resistance or good wound healing, etc. And for example, a patient's ejection fraction was just 20%. She was not fit for surgery. And within 5 days of Ayurveda medicine, her ejection fraction became 40%. So I can convert the high risk surgery into low risk surgery. So as a surgeon, whatever things I want to proceed smoothly, and wherever I have a limitation, I can make use of Ayurveda for patients' benefit. I think definitely law should make the correction in this aspect, which can make a significant contribution to patient recovery.
Yes, I too agree, because even in some cases we have seen allopathy will not work, but still with the law and everything, it will be there in our mind. But what I say, anyhow, we have started with CBME batch with the inclusion of Ayurveda, at least exposure to MBBS students for Ayush. At least they will be aware of this. At least with that, we should have a more integrated, holistic approach. At least even if we cannot use, we can take our Ayurvedic friends and those who are working for other traditional system of medicine, what is practiced in India, so that we can produce more of a evidence-based practice, so that even we can give it to the law that it should be more of a holistic approach rather than just sticking on to the allopathy itself. Of course, we will not go against the allopathy, whatever the terminology, what the law has got, but definitely in the interest of patient, we can make, if there is a possibility of randomized control trials in the future, we can include both, and then we can have a more evidence-based practice, then that will solve the problem. Of course, for holistic approach, we need every system of medicine to, because that is how our system is there. Thank you, Dr. Deepak.
Yeah, I think I can see a hand raised by
Good
Mail
evening, sir.
Pogli. So, yeah. Hello.
Yes, hello. Can you hear me?
Yeah,
Good
can you
evening,
just
sir.
introduce yourself? It would be, yeah.
Yes. So I'm a medical doctor from France in emergency, and now I live in India to continue a project on Ayurveda and emergency. I would like just to add something on side effect of the treatment and interaction. In allopathy, I think we believe we study everything and we know everything about interactions of medication, but our knowledge is very limited, in fact. One of the best pharmacologists in France told me that after 3 different medication in the same patient, we cannot know what the interaction will do. So many times we give more than 3 drugs to a patient, so we don't know and we cannot study it. And we ask Ayurveda to study the interactions. I think first we have to see the limitation of our science. Then the second part is we believe allopathy is totally proved by clinical trials. But in fact, only 18% of our practice is proved with a great level of proof. So we have to be just humble and give the same chance for the other system of medicine. And I think we have to start cooperative work. And with this cooperative work, taking case and documenting them, publishing, and give them to the policymaker to force them to change the law for the benefit of the patient. These are just my few suggestions. Thank you.
Thank you.
You're making a valuable suggestion.
I think if we don't have further comments on this, maybe we can go with our next speaker. So I invite Dr. Kritika to introduce our next speaker.
Hello, everyone. So I guess the next speaker we have is Dr. Jyoti Joshi. She's an MD Ayurveda. She's a chief physician in Joshi Panchakarma and has a 9-year of clinical practice experience. Dr. Joshi, are you here? Can you hear me? Yeah, can you please introduce yourself a little bit more, and then we can move on with your presentation on Ayurveda in COVID-19 in intensive care.
Am I audible?
Yeah, you are.
अज्ञानतिमिरान्धस्य ज्ञानाञ्जनशलाकया चक्षुरुन्मीलितं येन तस्मै श्री गुरुवे नमः. Namaste everyone. Myself Dr. Jyoti Joshi Mehta. I did masters in Ayurveda, and since last 10 years I'm practicing in Mumbai, a pure Ayurveda practice. During COVID time, I have treated more than 5,000 cases, and I have published 3 research papers on COVID and its outcome. In Pan India, I'm the one who published the COVID paper, research paper on COVID and its treatment. And I got first award in 2021 itself in April from PR Krishna Kumarji. And thereafter, I was the part of Prime Minister Narendra Modi had works with 100 doctors amongst the India who are working on ground level on COVID. So I was part of that discussion and I represented Ayurveda. And yeah, I think so that's enough.
More than enough. That's really nice to know you. So like we can now move forward with the presentation.
Sure. So first thing I would like to say that my aim of presentation is that at least couple of doctors from this CME should able to treat it's mild, moderate, severe, long COVID, post-COVID complications. So they are able to treat the COVID patients. So I think so that is okay with you. I don't want to just talk superficial, but as much as my knowledge I have during last 2 to 3 years of pandemic work, so that I'm going to share with you. So the first thing, while working on ground level, what challenges I have faced in India while working on COVID. So is it the first thing, availability of the medicine, because I have not treated the patient only from Mumbai or Pandil. We have treated the patient from different parts of India and from Dubai and from different countries as well. So availability of the medicine is the most important thing. Many a times I have faced this challenge. Then asking to follow a specific diet when the patient is admitted in ICU or the patient is admitted in any hospital. But in Ayurveda, the dietary regulation are very important. So this challenge is also, I need to somehow, how I tackle this, the challenges, that also I will brief. Administration of Ayurveda medicine ICU. If patient is on, the ventilator or the patient is on oxygen, then sometimes it become very difficult. We need to train the staff that how to administer the medicines. Then administration of Ayurveda medicine when patient, that I have already mentioned. And the last but not the least, that is written and informed consent from the patient, because I have started working on COVID in first wave itself. So in first wave, we being an Ayurveda physician, we are not legally allowed to treat COVID patient, but I cannot see the patient are dying outside the hospital because they are not getting oxygen or that they are not getting proper treatment. So this thing is very important, that is written and informed consent. So for each and every patient, we took that, and that is very helpful to publish the cases as well. So now I'll start with the first patient. When this is the patient, I have published this paper. You can see it in PubMed or like any other place. So this is the patient. This video is when patient is in ward. So yeah.
Dr. Jyoti, is there an audio to this video because we can't hear anything?
Can't hear it.
Can anybody else hear this?
Is
No,
it?
no audio.
Yeah, we cannot hear. Yeah.
No, we can't hear.
You can't hear. Yeah, let me explain. So this is actually, you can see this patient was admitted in actually Alibag. It is almost 80 kilometers from Mumbai. And this patient was actually very stable, but all of a sudden she developed the breathlessness, and her oxygen saturation dropped to 80. And she somehow shifted to nearby in like Mumbai, Panvel, nearby government hospital COVID care center. And there she's not getting bed. And they just approached me that what we can do. So we have started the treatment to her on stretcher itself. And that time she was on oxygen, but still her oxygen levels were below 80. And we have started the treatment and she's completely recovered. I have published this paper. These are some, as audio is not, but we can see in this case, you can see the oxygen saturation and grunting sound is also there. You can see the oxygen saturation. It was 45. The patient was on oxygen only. You can see it is reached to 85, 86. I think so. It is visible, right?
Yeah.
Because patient in Mumbai, the condition was that bad that patient was not even able to get the bed oxygen. No grunting sound. Patient is able to sit. These are some ICU patients I have treated. And this is the link of my papers. So you can go through these papers. Yeah, so now let me speak that while treating, the COVID cases, because if I will continue with the videos and all, because I've treated a number of patients, so a number of videos we have, but what is the basic principle I have applied while, the treating COVID cases. So basically, uh, I have seen the COVID in the COVID mild, moderate, severe. In ICU, generally, I have seen that there are very severe cases with all comorbidities and the old age problem as well. So basically, the Ayurveda diagnosis is the Sannipata Jwar, Vata predominant Sannipata Jwar, and thereafter it is Avrutta Vata. If I will show you the reference from this Ashtanga Hriday book, which we all follow. So if you'll see example of Avruttavat, so I will read the shlok, that is Nishvasa Ushvasa Savrodaha Pratishaya Shirograha Rudrogo Mukha Shoshascha Pranodana Avrutte Udana Vrutte Prane Varna Oja Balak Sangshayaha. So you can see we can correlate this symptoms with the COVID-19. So in COVID-19, I have started my treatment with Avruttava Chikitsa, the treatment, the first thing in a treatment, that is Chadharan Churna. It is mentioned in Amashay Gatvat, but it has given me excellent results. So I have started, I'm mentioning the medicines, that is Chadharan Churna, first thing for Amashay Gatvat, it is mentioned. So I have observed a wonderful result with Chadharan Churna. Then I have used all the, because in very severe cases we have given the Ayurveda treatment, so herbo mineral and only mineral preparation also I have used. So in severe cases we used to give the Shadanga Paniya, that is Muhur Muhu, and we used to train the nurses to give it in a Muhur Muhu, how they can give at least 2 ml, at least they should give every half an hourly or so. So Shadanga Paniya, no plain water. Then we have just asked that that's Shadharan Churna. And when I have meeting with WHO, that time I have explained that when oxygen level were very low and there is no oxygen, or we can, like as earlier doctor mentioned, that high nasal flow oxygen supply, if that is not available, because in first wave the condition in Mumbai was very worse. So at that time we have started with sublingual administration of couple of Ayurveda medicine. In that I use Rasa Sindur, because Rasa Sindur, if there is a ground glass opacity and COVID score or whatever, in severe condition also sublingual administration of Rasa Sindur plus Shadharan Churna, and with that, if it is needed, Naradiya Lakshmi Vilas Ras, it has given me excellent result. But it is in a very micro, the quantity is very micro nutrient, because hardly 60 milligram we used to give, and it has given excellent result to increase oxygen level very, easily and very quickly. Because while working on ground level, we have not even getting the oxygen as well. So sublingual administration with that simple, with O2 cylinder, we used to give that oxygen. So these things I have used, and thereafter we have a long COVID cases. So in long COVID cases, only this Rasa Aushadhi, because everyone is talking about, the Lakshmi Vilas Ras. We have so many, the herbal or herbo mineral preparation. But in long COVID cases, I have observed that administration of a Grutapanam plays very important role, because there is a fibrosis and it is prolonged. So somewhere severe Vata Avastha, Vata Prokop were observed. So in that thing, administration of Indukantam Grutam is means I have observed that administration of Indukantam Grutam, though the patient is diabetic or something else, or patient has so many comorbidities, Grutapan, even interleukin strong, because we used to do so many tests in COVID, that is like LDL, then interleukin, IL-6, then serum ferritin. So to reduce those levels as well, we have that data as well. You can see all these things in my research paper. We have mentioned everything, like how it is reduced. So in those things, I have used a Grutapan, starting from Dadimadi Grutam to Indukantam Grutam to simply Mahatiktam Grutam, because first thing I have written that as availability of the medicine. So Mahatiktam Grutam I have seen in Dubai and all. were easily available. So starting from that, with that we used to add just 60 milligram of rasa sindur and all, if it is needed, if still there is a coughing or something. And we have used kankasa also, because it is also very easily available in India and in other countries as well. So kankasa is also gives very excellent result. Then it is like post-COVID. In post-COVID, I have seen a severe fibrosis with that brain fog. I have seen so many patients are having confusion. They are having, that depression sort of symptom, or they are having, the difficulty while concentration. So in those cases also, starting from Shirbala 101 capsules to Grutapan, because many a times if patient is admitted in hospital, so it is difficult. So you just pierce that capsule and you just administer 2 to 3 drops of Shirbala or Dhanvantaram, depend on which case it is. So that gives excellent result. So, not only just giving herbal or herbo-mineral preparation, or just giving, Kasagna treatment or Vatagna treatment, that is not enough in the COVID, because patient, though we are able to maintain the oxygen level, but after that also, because of interleukin storm or cytokine storm, we have seen the organ failure, and because of organ failure, patient used to die. And to avoid that, definitely Snehapan, Rasayan Chikitsa, because our every adhyay starts with, the Nidan, and then Samprapti, that is pathophysiology of the disease, and thereafter some Rasayan Chikitsa. Everywhere, somewhere Rasayan Chikitsa is mentioned. So we, through every patient, whatever the patient I have treated, we have asked them to have medicated Gruta or some sort of Rasayan Chikitsa, and it has given excellent result in all COVID cases, except one old age lady. She is around 85, and she died because she didn't receive oxygen. That's why she died. Otherwise, we are able to save each and every patient, and still those patients are not having any sort of complication, because we are observing that there is a vascular necrosis of the joints and everything. So AVN and all, so many complications were observed. Still, we are working on that as well as a research part. But still, I have observed that whatever the treatment we have given, that has given a very good result. Another medicine I would like to add on, that is Apamarga Kshar. Apamarga, if you see in different, from Veda Shastra, in Veda also, Apamarga is mentioned. So Apamarga Kshar, even Char, if Apamarga Kshar is not available, then we ask the patient if Kalyana Kshar is available. So Apamarga Kshar is also giving excellent result. That to just mix it with the Guduchi Churna or Shadharan Churna if it is available, and just give it in sublingual administration. Because see, while sitting here and talking about COVID-19 in ICU care and everything, it's quite easy. But while working on ground level, we have faced so many challenges. That is what I want to share, starting from availability of the medicine. So Apamarga Kshar, I have seen a very good result, especially the COVID patient with diabetes, type 2 diabetes. Apamarga Kshar has given excellent result. And I have already mentioned about the Rasa Sindur. That is a drug of choice in so many cases where ground glass opacity has observed. So, in this way, we have asked the patient to, just completely recovered with, without taking any sort of steroid, Fabiflu, or any sort of injectable, the patient are recovered. Because that 26 years old patient, she is already on so many, starting from steroid to so many medication. And that time there is only Fabiflu were going on in India, but steroids were common. But still she is not recovering, and she is getting so much of fatigue. Finally, she have given in return to allopathy doctors that I just want to continue with Ayurveda. And that's how I got the confidence, and I have observed that with Ayurveda we can give so much to the this pandemic or to the COVID patients. Any question till now?
I think Manmohan ji has a question. He has raised his hand. Manmohan ji, can you please unmute yourself? Am I audible to everybody?
Yeah.
Yeah, you are audible. Yeah.
Manmohan ji, do you have a question?
Yeah, can you hear me?
Yeah,
Can you-
yeah, now we can hear you. Yeah,
Yeah,
Manmohan ji, continue, please.
Namaste Nehaji and to all the members. My question is that how many universities in India are teaching Ayurveda to medical students, regarding this Ayurveda? How many universities do we have in India who are teaching Ayurveda to the students of today's era?
There are so many universities. I stay in Maharashtra. So in Maharashtra, there is Maharashtra University of Health Sciences, that is MUHS.
Are they all recognized universities?
Yeah. Yes. We have
So
a
how
government
how
colleges
many-
in 5 states.
How many students do come out as medical students graduated from universities throughout the year?
I
Each
did
year?
my master's. Yeah, I did my master from Government Medical College of Mumbai, that is Podar Medical College. So we are like for UG we have 100 students.
But in compared to the ratio of allopathic medical students, what ratio students in India study Ayurveda? Are overseas students come to India to study Ayurveda? What ratio is it?
Yeah, overseas students are there for the masters, and even in national institutes like Jaipur and Jamnagar, there are so many Ayurveda students from different countries. Like in December, I have attended WAC, that is World Ayurveda Congress. So I've met so many international delegates, and they are not only delegates, but they are studying in Jamnagar, Jaipur or BHU. And even our Podar in Mumbai also now, there are so many students from Russia, France, like different places.
So if the world is accepting Ayurveda for studies purposes and practicing purposes, why isn't Indian government, especially Ayush department, is not putting enough effort that to bring this Ayurveda into worldwide?
See, while working as I have started working on COVID since first wave itself, so that time I have seen that we are lacking the documentation. While because we have meeting with ICMR people, we had meeting with WHO people. So like we need a complete data. Like I have shown you this videos and everything, but somewhere we are lacking in the data. Verbally, there are so many people who are talking like we have treated this many patients, this many cases, but they just want a data. And somewhere we are at better place as compared to earlier.
Well, I understand that the data is very important because obviously the human life, but the main thing is that if India has got so much wealth of Ayurveda knowledge, why is this not being taught to all the medical students? I mean, when some students want to study medicine, they go for allopathic, but there is no sign of encouragement from the schools and colleges to encourage students to study full-time Ayurveda, so that we can send those students after qualifying as medical students to become surgeons and show to the world that India has a lot to offer to the world in Ayurveda. I have seen very good reports on COVID, which I have seen myself, COVID patients. I have not vaccinated myself, and I picked up a COVID from someone, and I was cured within 24 hours with the medicine. So I've got full confidence in Ayurveda, and that is what inspired me to bring Ayurveda in United Kingdom in every hospital as an option to give patient a choice whether they want to be treated as alternative treatment or whether they want to continue on allopathic. So what I expected is that India should do as well the same thing, is to implement this in all over the hospitals in India and give patient a choice whether they wish to be treated in the Ayurveda or whether they wish to use allopathic. We all know allopathic has got side effects. Ayurveda has very limited side effect, maybe zero, I would say. Very unlikely that Ayurveda will have side effect. But what I am basically concerned about is what is Ayush department in India is doing, that when the world is recognizing Ayurveda, and Ayush department is not putting enough effort to spread this all over India. Once it's spreaded all over India, it will be spreaded all over the world. I've seen your video. I'm impressed with that. You have cured lots of COVID patients. India had a cure of COVID, but our Prime Minister Narendra Modi ji sent vaccines to the world, whereas he should have been sending this Ayurveda medicine to all of them and showing them that Ayurveda has a gift of what you call the health. People could be cured easily. So
Absolutely,
I
sir.
think the specialist consultants like yourself should be having a meeting with Ayush department and tell them to put their more efforts into this, because otherwise the West will come up with Ayurveda first and then East will basically follow that, which is what history shows that to us. So I want East to bring Ayurveda first so the West can copy it, rather than West taking it up from us and implementing, then East will then follow it, which is not a good achievement for East to do that.
Absolutely, sir. But I always live my life, and for practice also, there is one principle in my life, that is, what is the best or what is the positive side that should be seen, and we should go ahead with that positivity. Because while studying also Ayurveda, we have faced so many challenges. There is so many, because of globalization, there is so much of affection towards the ICU, working in the ICU, and so many, the different departments and everything. So in that also, if there are so many doctors who are practicing Ayurveda, and previously there is nothing in India like separate ministry for Ayurveda and everything. But as of now, there is a ministry for Ayurveda, and I have seen, like, I am working in one corner of the India or the Maharashtra in Mumbai, but still they recognize my work. They have, from other pathy doctors, like PM had interaction with 100 doctors. Among that, there are Ayurveda doctors as well, and they heard from Ayurveda doctors as well. They encouraged Ayurveda doctors as well. So whatever there as a physician in my hand, that side I can see. Otherwise, if you'll see the only thing, like, there are so many challenges, I accept your each and every word, but amongst that, there are so many positive things as well. Because COVID time, I have seen there are so many people who used to talk with me, who used to, forget about the appreciate, but they have so many queries. How you did that? How which medicines you are using, which reference you are using. So that is how we have, and starting from written and informed consent form to everything. So I got so much of, the support from everyone. That's why we are able to publish 3 papers, and the first paper from Pan India, that documentation and everything. Because I'm a physician, but still I have my own limitation to write the paper. Still morning or midnight, 3 a.m., 4 a.m., I used to work. At that time, there are so many people, person who used to, support me to write the paper, and to, that making the charts and everything, because that is complete theoretical thing. And just writing the paper and working on COVID, that to ground level, is like tough. But still we are able to do, like, so many physicians did that. That is only because we are getting support. Like, still COVID is, we cannot say it is over, but it is in control. But still, like, from UK, the work got recognized. So that is like, this shows that we are standing somewhere. Still, there are so many people who are interested what exactly Indians or Indian doctors did on ground level during pandemic time.
I agree with you, but I think Ayush department had a big role to play in COVID, which they have failed to do it. And this is what is disappointing to us, because if Ayush department had done what really they had, wealth of COVID cures, and they should have basically, instead of exporting vaccines, they should have given this Ayurveda medicine. The world would have recognized it and the world would have appreciated it. And I think that is where doctors like yourself should really have meetings with Ayush department, because the reason is I can see that what will happen in years to come, that Ayurveda will be acceptable to Europe, to the West, and then East will follow. And I don't want that happening. I want East to implement that quickly as possible, because COVID evidences, cure evidences are available. And basically what our Prime Minister Shri Narendra Modi ji should have a serious meeting with Ayush department to say, look, we have got cure. Why are we not pushing this through? This is a golden opportunity, number one. Number two, I think the students who want to do medicine, and suppose if they don't get the places in university in India, they should be given an option to study Ayurveda medicine, because Ayurveda medicine, they should be taught that Ayurveda medicine is the future of the world. And this is where, if India can generate Ayurvedic students, there are two differences in Ayurveda doctors, and there is a Ayurveda, what you call the professors. Now, what is happening, my experience shows me that Ayurveda professors are also trying to practice, which is what we should not let. They should be teaching students and not concentrating on curing patients. That is getting mixed up in Ayurveda. That's where people have very little confidence in Ayurveda, because you don't know whether the professor is a doctor or whether he's a professor. They have a knowledge. I respect their knowledge. But I think what Ayurveda professors should do is concentrate on bringing students out with their wealth of knowledge and experience, and let practitioners learn something and give them confidence so that they can prosper further. I've come across myself professors, so many professors of Ayurveda I have met here in UK, and they say they do treat patients, which makes me worried that this is not what allopathic professors do. So I think really and truly there should be something, guidelines should be put in by Ayush department, that the professors should be told that, look, you create education and bring the wealth of knowledge out, and let students who want to go into practice or surgery or anything, let them do this thing.
Correct, sir.
Yeah.
Yeah.
Thank you.
I think, yeah, Dr. Ashut want to make a response, I think. Yeah, Dr. Ashut, please.
Yes, sir. I want to add some points to some of the points which you have made. As I have been seeing the two systems of medicine very closely since childhood, what I've seen is, for example, in one of the prominent hospitals of Mumbai in 2005, the study showed that for anti-tubercular treatment, Ayurveda is much better when it comes to the effectiveness or the minimal side effects, etc., when compared to modern medicine. And it was sent to the central government to be included in RNTCP, in the tuberculosis program. And the problem is in India, sir, even to say whether Ayurveda medicine has to be implemented in health policy or not, the boss is a modern medicine physician who has no idea of Ayurveda. And for example, the intention of our Prime Minister might be good, but the problem is each and every health policy, the decision is taken by a modern medicine physician who has zero knowledge of Ayurveda. And from the time I am pursuing my MBBS, when many of my professors wanted to study the effectiveness of a particular Ayurveda medicine, when they saw the results of some of the patients I treated, the medicine we have to satisfy, even for an Ayurveda study, it has to satisfy the guidelines of ICMR. And the rules of research for modern medicine and Ayurveda is very much different. So they want to, in order to implement it a larger population, they want Ayurveda medicine to satisfy the research methodology of modern medicine, which is not possible, sir. So I think in India, there is a major problem of law. Unless we change the law so as to incorporate Ayurveda in a bigger way, I think Ayurveda doctors' hands are tied much. And another important difference, what I was saying is, many patients come to me, they spend 30-40 lakh for insurance for chemotherapy. But for Ayurveda, they were not getting insurance. They spend 30 lakh and their health is spoiled and they have lost their health and money. But when they come to Ayurveda, they don't have money to pay for even for 10,000 per month, which can give them a lot of benefit. So I think we should take care of these small things, and we cannot put the blame only on. Definitely, there is a role of each and every the doctors, government, etc. I think unless we fix these small things, and many laws, sir, I cannot treat as an Ayurveda physician, I cannot treat a chest pain patient, or for example, during COVID, how the stringent, even if the patient was dying without the availability of beds, we still tied the hands of Ayurveda doctors, telling that if you treat Ayurveda, if you give Ayurveda medicine to a COVID patient, you will be behind bars. I think unless we change the British mindset, sir, I think we will not be able to help much to incorporate Ayurveda.
Yeah, I agree
Thank
with
you.
you.
Yeah.
I do agree with you. But the thing is, you see, the Ayush department. This is a job of an Ayush department, which the Prime Minister, Honorable Prime Minister Saab, has appointed that department. Now, if that department doesn't do, I'm sure the citizens of India should be able to send somewhere notes to the Prime Minister that this Ayush department is not doing its job, what they should be doing. Because I expected, being an Indian, national, that Ayurveda was the golden opportunity in COVID to spread the message of Ayurveda. And instead, we went for all these Pfizers and all these things, which was not necessary, because the world already knows about these Pfizers and the vaccines. But there was a golden opportunity for Ayush department to come forward and offer a treatment which the world would have respected it and recognized it. But yes, I agree with you. There are not enough evidences available. But like Dr. Joshi said, she treated the patients. She cured the patients. And the result, positive results, makes us proud that, people were cured in India with this Ayurveda treatment itself. So having myself treated by Ayurveda treatment, and my own nephew, my own son, my own daughter-in-law, who is an allopathic doctor, I refused to vaccinate. They said to me clearly, "Dad, you're playing with high risk." I said, I'm not. And when I did pick up the COVID, I quickly met Dr. Avtar Singh ji at the time, and he gave me one small tablet, which is a black pepper sized tablet, in my tongue, and I was cured within 24 hours. So now you can see how powerful the Ayurveda is. Now, like yourself, Dr. Joshi said, we have got, we need to pass through this, what you call Ayush department and all the medical departments. I think evidence is clearly in our Vedas for Ayurveda. So I don't know what evidences India wants, Indian government wants. It's all written in Vedas, and there are practitioners who are practicing in Ayurveda. Their practice should be recognized, their efforts should be recognized, and it should be implemented in India. But because our reason is, until and unless Ayurveda is implemented in East, West will not be able to accept as evidence. But if West introduced it first with the successful reports and results, then if East takes it afterwards, it's not really a good idea. So this is what my main concern is, that Ayurveda should now be practiced in India in full swing, so that we should respect, the world should respect the Ayurveda. Thank you.
Thank you, Manmohan ji. I guess Dr. Avtar has another question.
Can you hear me?
Yeah.
Okay. Manmohan ji said very good, question asked the Ayush Ministry and everything. And first of all, that is if India is not supporting, like Dr. Joshi done so much good work, and other also done. I gave the medicine first in the May 20. There's so many patients, when Dr. Joshi here, they sent the letter to the Ayush Ministry. When I done the nearly 20 patients, clear the 20. In the UK, is not so many people come to us like that one. And all the patient came to COVID patient to me, they all cured. More than 120, 125 positive patient cured within 3 to 4 days. I not give more than 1 week medicine to anybody. But no one answered from there, and some professors from there, I don't want to mention their name, and so many people, they are asking me, ring me so many times, give us the formula. What is the formula you use? I say, I clearly said my videos then, I made the video and spread that one. I say, I don't need any single penny. That time, so many people was dying there. And like Ramonji mentioned, I made the tablet. It's like a black pepper size. Nearly 19 ingredients inside. I inside extract I put it. All 100% Ayurveda. I designed that one. That medicine, first tablet starts stopping cough. Within 2-3 tablet, I also give the other things. So I made the one symptom form, the 19 in like you mentioned, I call the Vishma Jwar. When Dr. Venkatesh Joshi, he recorded my 3 videos. He asked me the question, what kind of this is fever? He respect me a lot because he been so many patients, seen patient with me like a cancer patient. After that one, he respect me very much. He know I am on the research and I made so many medicines, so many systems. That one on the COVID, I told them, you can't treat the same medicine with every person because the reason, like you say, Vat, Pitta, Kapha, the mixing, which kind of patient we have to treat. Dr. Jyoti, really, you done very well. I congratulate you and respect you. You are very young and you done very good job. And the same thing I told them. Not one, nearly Kaya Sampradaya, other group, so many group that one, they are asking me like a mad people. I say, you are Ayurveda practitioner, you should understand. Ayurveda, next 5,000 years, no one can prove that scientifically. Ayurveda is based on the custom-made medicine, according to the patient. Every person have their own system. Every person, you don't know the what is extra, pit is extra, cough is extra, which dosh is mixed up. If Ayurveda practitioner learn that one, like you mentioned that one, other that young doctor learns from so many, I forget always his name, what is his name, and doing that one. So you give the both very good information. I say, I made the one symptom form, just pin it out, which one you have, then I make the ingredients. Very simple. And I made the tea for that one, tablet for that one. And also I have one medicine, which one I use for the cancer patients. I'm telling, I told everybody. That is, I call Sarbaroga cleansing. Believe that one, till now, I'm using from last 40 years, any kind of toxin inside the body, anywhere in the body, you no need panchkarma. I designed that one. I never gave panchkarma to anybody in my life after I made it, that one. And that one is, I cure the ADHD patients, I cure the cancer patients, and I have the videos. In the UK is a law, we can't show without the patients ask, but so many about me. The Dr. Kapil Sharma is GP here, MBBS, Dr. Joshi, they wrote about me, patients, some wrote about me on my website. And one is difficult is dementia and Alzheimer patient. That dementia is from 9-year, 8-year dementia, then Alzheimer gone into, that patient is doing now yoga, walking, playing with the children and living normal life. I made the video on their permission. What that is cleansing from the brain. So we have a lot of hope with that medicine anywhere in the body. I never give any skin cream to anybody. I just give that one. They clean up to skin, brain, anywhere. Even I give that one to my diabetic patient. That formula I made near about 40 years ago because my mother died with the cancer. I done promise with me. I asked my father, why not you cure that one? He says, he's too weak. We can't give the panchkarma to clean the toxins from the body. Everybody know panchkarma only can give if their life is a little bit, person is a little bit healthy. On the deathbed, we can't give the, I gave that medicine, that Sarbaroga cleansing on the deathbed. Every cancer patient I give to them, and the result become very good. The result become within a week. I always say, even a cancer patient, as I told you, if you can't get the benefit within 1 or 2 weeks, 5-10%, don't come back to me. I challenge. And also, I just want to say to every Ayurveda practitioner, don't blame on the allopathy. You prove it, like you've proven that one. You prove it, Ayurveda is the best. Show the patient you can do it. Most of patient I seen, I have to say this one, 80% doctors, allopathy practitioner can't diagnose properly pulse reading. I seen with the sitting with me, they know. And Manmohanji are my witness. They send so many patients to me in my clinic here. They live, we are on the same place, same city. And they
Dr.
see
Avatar, I mean, sorry to interrupt. I think we are crossing the time.
Okay.
So thanks a lot for your.
Okay, thank you very much. And thank you, Nehaji and everybody. So Ayurveda, as Manmohanji said, if we do all together from India, Modiji do something, this is the best therapy. We can cover whole the world and give the very cheap treatment to them. They don't have to spend billion pound on the every health ministry. Okay, God bless you all. Thank you very much.
Thank you, Dr. Rao.
Yeah.
Thank you.
Thank you, Dr. Rao and Dr. Joshi, who just shared a very crucial information with us. And really glad that we could hear you today. Do you have anything else to say, Dr. Skantesh, at the end?
Yeah, I think as like Manmohanji also, I think actively participated in Ayurveda NHS incorporating. I think this integrated Ayurveda network is also believing how we can capture, document this kind of evidence-based practice from the physician's perspective. So as we had earlier, this theme also will be documented, and as like earlier, many people will be seeing after once the recorded video is coming out. So I think in possible way, we can document this as part of the practice-based evidence initiative. So what is clear from here is how a physician can turn into a researcher, as like Dr. Ashwath and Dr. Jyoti, despite of working in the chaotic pandemic, how, coming up and treating patients. Along with that, but documenting it and publishing these kind of cases is very important, since it makes an evidence evaluation and evidence kind of a practice for a complex system like Ayurveda, which is very important. So this practice-based evidence movement need to be more strengthened in order to mainstream traditional medicine and Ayurveda that as like a complex system intervention globally. So we need to collaborate, cooperate globally in order to make sure that we come up with more practice-based evidence, which is more appropriate with the epistemology or the function of Ayurveda system. So I thank both of the speakers for their wonderful work and document this evidence. And we will also need to be work forward to document these conference, like these sessions, in order to have much more better evidence-based kind of a documentation in the future. So I thank the speakers and wonderful audience who make this interaction more meaningful and more rich exchange of ideas that has made relevant to the our initiative. So I thank everyone on the behalf of Integrated Ayurveda Network and Aarogyam UK. Thanks a lot. Yeah.
Thank you very much.
Thank you, doctor. Thank you.